Hi, good morning, everyone. It is truly my privilege to invite my supervisor, Dr. Garrett Sim, this morning to share about his work in pharmacogenomics of drug abuse and dependence. Dr. Garrett Sim currently works at the Department of Pharmaceutical Life Sciences, Faculty of Pharmacy at University Malaya. His research focuses on behavioral science, genetic epidemiology, psycho and neuropharmacogenomics. Now, I would like to pass this session to Dr. Garrett. Thank you.
Okay. Thanks, Natasha, for the introductions. Okay, let me share my slides. Okay. Good morning, everyone. Today's I would like to talk about the pharmacogenomics of drugs abuse and dependence. Specifically, I will discuss on how we can use the genetic to apply in the prevention strategies and tailor the personalized medicines for individual struggling with drug dependence. Okay. Before we jump into pharmacogenomics, I want to introduce someone very important. Okay, some of you might recognize him. I know some may not. Okay, his name is Hippocrates. Okay, and he's often called the father of medicine. In the 2,500 years ago, Hippocrates already figured out some things or a theory, very important theories. Okay, the same drugs doesn't work the same way for everyone. Some may feel great, others may not feeling good. Okay, when they use drugs, but why? So this question has puzzled researchers for centuries. It leads to the study on how our genes affects our drug response. And that's the heart of what we now call pharmacogenomics. So amazing. If you have two patients with the same symptoms and same diagnosis, and even give them the exactly same drugs at the same dose, but the outcomes can be totally different. Okay, for some, the drugs work well and is effective. Others might not see much of benefits. And some could even experience harmful side effects or adverse effects. So this is where the pharmacogenomics comes into place and help us to figure out why it happens. So why does this happen? Why different patients respond differently to the same drugs? Sure, you can say that it's just luck, okay? But honestly, it's not something that we can predict easily. Actually, a lot of factors affect the drug response. So among all these factors, genetics really stand out because it can influence so much like your ethnicities, your age, disease susceptibilities, and even how drugs interact with your body systems. In the genetic factors, genetic variations or what we call polymorphisms are very common. So these genetic variations are very useful, not just as a markers for understandings or understandings and preventing disease, but also for customizing treatments to fix individuals' patients. Due to the individual variations, about 20 to 40% of the patients benefits from an approved drugs. So we can see that only very low percentage of patients really benefit from the drugs. And 70 to 80% of the drug candidates fail in the clinical trials. And many approved drugs removed from the markets due to the adverse effect. Okay, so you can see that a lot of drugs they can be removed from the markets after 10 years or 5 or 10 years or 20 years due to the adverse effects. Therefore, we can use the DNA sequence informations, okay, to identify or predicts the reaction of drugs. So this is why the field pharmacogenetics or pharmacogenomics comes out nowadays. So by using the pharmacogenomics or pharmacogenetics data, we can personalize drugs and we also can faster the clinical trials. And the most important is we're able to minimize the drug's side effects or adverse effects. Just like how different people respond to medication differently due to their genetics, the same principles apply to additive drugs as well. Okay, for example, the methamphetamines, amphetamines, heroin, and so on. So everyone knows these drugs are additive. Okay, whether someone is more susceptible to certain drug use can also depends heavily to their genetics makeups. Are people predisposed to addictions, or are they addicted because of their surroundings? I believe that most of people think about addictions is mainly caused by environmental factors like drug exposure, believing that if you take a drugs, you are definitely get addicted. But according to some research, okay, they suggest that um, an individual genetics might also contribute for 25 to 60% of the risk in developing a specific addictions. And next questions, have you even wondered why some people get addicted to a drug so easily, while some do not? Actually, one of the biggest pieces of puzzles is our genetics. Okay, research has shown that our genes plays an important role in both the risk of substance dependence and also chances of relapsing after treatments. In fact, you can see the APA reported that at least half of a person's susceptibility to drugs addiction can be linked to the genetic factors. Just like other medical conditions, addiction is influenced by a complex mix of genetic factors. When this genetic tendency combined with environmental influences, it can make it harder for someone or some people to resist addictions. But it's important to remember that having a genetics predisposition for addictions, it doesn't mean someone is destined to become addicts, because it just shows the risk. Okay, it means that they have the higher risk compared to the non-carrier. Okay, okay. So from this figure, you can see that each person has a unique genetic compositions. Okay, everyone know. Okay, when exposed to the same drugs, these genetic differences can lead to various responses. So in this animation, you can see that we take a group of methamphetamines, okay, methamphetamine user. Not everyone has the same experience, okay? Well, some might feel euphoria, okay? Some might not, okay? So the euphoria is the feelings that the methamphetamine user looking for, okay? Some may not experience it, and some even could suffer from adverse effects. That's why some people are less likely to use methamphetamines. They may use other stimulants or other drugs. So in this slide, it shows that these are some of the addiction-related genes. Okay, for example, like opium receptors, okay, serotonin receptor genes, which are associated with the susceptibility to substance addictions or substance dependence. Well, PRO1 and 2 and the neuropeptide Y genes are associated with alcohol use. And this figure illustrates the potential pharmacogenomics biomarker that can be used to personalize methadone treatments based on their the genetics variations in different populations. So it highlights the role of the ABCB1 genes, which is crucial for drugs absorptions, distributions, and eliminations, as well as several cytochrome enzymes, okay, involved in the methadone's metabolisms. And these genetics variations are linked to populations such as Caucasians, Han Chinese, and Malay individuals. Due to the methadone's potential adverse effects such as overdose, overdose symptoms, sexual dysfunctions, or QT prolongations, understanding these genetics markers allows the healthcare providers to tailor the methadone's dosing and the treatments more effectively, leading to the safer and the more efficient therapy. Okay, so this figure underscores the importance of how pharmacogenomics in developing personalized treatment strategy for methadones in managing opiate addictions. Well, minimize the adverse outcomes. Furthermore, another study reported that naltrexone, a drug that has high potential to be used to treat heroin addictions, can be used has a potential to repress methadones. These naltrexone, they found that it will be more effective in treating heroin addictions if the patient with genotypes AG or G2 in the mu opioid receptor genes. So in other words, individuals with the G areas are more suitable to use naltrexone. Okay, while looking at our research findings, we also found some interesting associations. Okay, our studies genotypes various genetic polymorphism among the methamphetamine users across the different ethnic groups in Malaysia. We have conducted the whole genome sequencing. Okay, we found more than 10,000 polymorphisms in our Malaysian populations. Okay, but the results still in analyzing. Okay, so far we found that BDNF RS6265 polymorphism is strongly associated with methamphetamine dependence and psychosis in the Malaysian Chinese populations. So, however, in the Malay population, the FAH polymorphism, which is involved in breaking down the fatty acid amides, is associated with the methamphetamine dependent and methamphetamine induced mania. We also found that polymorphisms in the DTMBP1 genes is associated with the methamphetamine induced panic disorder in the Malay and Kadazan Dusun populations. Besides that, we also studied the SOD2 genes which encodes critical antioxidant enzymes. We found that RS4880 and RS284298 polymorphisms are linked to methamphetamine dependence in both the Chinese and Kadazan Dusun populations. And interestingly, the RS480 polymorphism is also highly associated with the methamphetamine-induced suicidal thoughts or suicidal ideations, specifically in the Kadazan Dusun populations. In our research, we also investigate the combined effect of multiple SMP or polymorphisms in genes, known as haplotypes. We call it haplotypes. So a haplotype is a set of DNA variations that are often inherited together from one generation to another generation. Study haplotype can provide more accurate insights compared to the analyzing a single polymorphism or variations. So in this table, our finding reveals that these combined genetics of variations in SOD2 genes were significantly associated with methamphetamine use and dependence across the Malay, Chinese and Canadian Muslim populations. So in conclusions, pharmacogenomics data is becoming increasingly valuable in understanding why drug response vary from person to person. This knowledge will be crucial for predicting, preventing, and intervening in the treatment plans. So by understanding the patient genetic profiles, the healthcare providers can tailor the dosage and choice of medications to maximize effectiveness and also minimize the adverse effects. Okay, so this personalized approach not only enhances the treatment outcome, but also can reduce the cost of buying ineffective or unnecessary medications. Amazing a future, you could walk into a pharmacy with your genetics profile, its genetic information, and the pharmacist can provide you some perfect medications. Okay, it's very effective and has no unwanted side effects. It's amazing to think about, but with the pharmacogenomics, that future might be just around the corner. Okay, so before ending my talks, I would like to highlight our laboratory services, okay, that we provide us. So which include the genotyping services. We also provide the genes and proteins expressions analysis. So if you are interested to know about this in details, you can drop me a message. Okay, that's all from me today. Thank you, everyone.
Hi, Doctor. There are no Q&A. There's no questions in the Q&A section.
Oh.
Yeah. So maybe we can open up the floor if anybody wants to put in the questions.
Right. I think if there's no question, Noorjahan, shall we wrap up and end this?
Agree. So thank you very much to the speakers and panelists and Dr. Anastasia.
So again, I'd like to invite all of you, the participants who has logged into this webinar today and all the speakers, do join us in Plaza Atas at PPUM to celebrate our very important day today, Anesthesia Day. Before we end, I'd like to wish every one of my colleagues out there happy Anesthesia Day. And thank you, Dr. Gareth, for that lovely talk too.
Sure, Prof. We will go and visit that.
Thank you.
Okay.
Thank you.
Thanks, everyone.